All righty. Good morning, everyone. I think this is one of the first full sessions, and very timely topic based on what's going on in the world around us. Interestingly, a couple things that Jack Dangerman touched upon in the welcome this morning. I hope everybody got to see that, but that was kind of a hats off to Kentucky for one thing in particular. And that one thing is how we have a very rich history of sharing data. And I want to make sure that everybody understands that that's kind of a common theme of what I'm presenting on this morning, because this is a unique opportunity as well. And Jack touched upon this. We're now seeing GIS, on the news. We're seeing maps. We're seeing things displayed in a spatial manner. And in all of my years of doing GIS, and I've participated in events where there was a flood or a tornado or an ice storm, or trying to court big manufacturing firms to the states, all of those sorts of things. But this is one opportunity or one instance where GIS is really all of a sudden is kind of in the mainstream, and we're seeing it. We're seeing it on our screens on a daily basis in one way or another. And before there was even a case in Kentucky, Tom Rossman, who was one of our previous directors, sent me a link and said, "Hey, have you seen this this dashboard that John Hopkins has got up?" And he went on and on and on about how this was so effective and a great way to display the data. And I found it very interesting that that folks were already seeing that before there was even a case in Kentucky. So where matters, and I think one of the things that really came to focus here is in early March, Emergency Management called together their GIS and IT work group, and there was probably 20-25 people in the room that day from a broad range of agencies, and I'll list those here at the end of this particular story map. But immediately, it was made very apparent to us that GIS was the tool. That was the tool that had to be used, and that was very obvious to everybody in the room. But even in those first few days, friends and family, and even other people in leadership positions in state government were kind of confused and kind of scratching their head. It's like, well, how does a map play into this? How does a map play into how we're going to respond to this? And anybody that's a geographer and knows about the John Snow story and the cholera outbreak and all of that good stuff, and the Broad Street pump and taking the handle off, understands that where I'm going with this. But like I said, it was apparent to us, and as geographers, I think it was probably apparent to most people, most of the campers out there, that we could play a role. So very early on, one of the first things we did was we had an incident at a particular facility up in northern Kentucky, and we get this call from the Office of Inspector General, and they want to know all the long-term care facilities within a 25-mile radius of the specific facility. And we were still working in the office at this point. We hadn't even been sent home yet. And we had just started weeks prior to this, mapping these long-term care facilities. And we were getting all those locations set up just right. But literally within a few minutes, Kevin Hogue was able to put together this nice interactive map, and we got it to him and answered some questions. And one of the themes I've heard over and over again as I've worked with other states is they didn't have a lot of data. They weren't really prepared for this in a way that I think Kentucky was. One of the things that I think is so simple for us is, we had all of our hospitals located, and we have a way of keeping that up to date now, but I'm learning that a whole lot of states did not have the benefit of even having their hospitals located. And a lot of folks will say, well, we had their address, we knew where they were, but I think anybody that does GIS knows that just because you've got an address doesn't mean you know the location, and don't need to preach on that. But because we have a lot of this data, because we have this broad range of expertise, and the folks that were brought to the table in the IT work group, GIS and IT work group, were across the executive branch of cabinets. But really, this goes even deeper down into our communities, and even at a regional basis. So we got a lot of data, we've got a lot of expertise, and there's this willingness to collaborate. And once again, Jack touched upon that. This photo right here that's showing up, I mean, this is pretty powerful. Here we've got our governor. He's standing in the Emergency Operations Center. This is back in May. And he's looking at this geospatial dashboard that is a part of one of the internal hub sites there. And evidently he turned around to somebody and said, "Who built all this stuff?" And, that was hats off to us, the GIS community as a whole, that we had this information, we had this expertise, and we were able to put these things in front of decision makers so quick. So, the point is that our collective GIS data resources and expertise are being leveraged to create actionable information. And I think it's important, actionable information that empowers decision makers. Folks are looking at what we're doing, and they are making decisions. And if you've heard me talk about GIS in the past, you know that it's all about decision support. So, and this is obvious to everybody who does GIS, but visualization, that's really what we're all about. As a lot of this data started rolling in, and we started putting case numbers on the map, at least, and I'll have to say at least once or twice a day, Kim would just say, "That's just not the way to display it, Kent. You're doing it wrong." And she said, "You got to normalize this data. It's not making sense. You're not showing it right." And as geographers, we all know that. But our decision makers would say, "Well, we want to see these cases per county." And so we throw those numbers on a map and we get it in front of everybody. But what we weren't showing is we weren't normalizing the data. And so what you're seeing here on this particular map is look out in Western Kentucky. Butler County's only got 14,000 people in it, but the number of cases in that county, per 100,000 population, put that in a whole different category. Sure, there's more cases in Lexington and more cases in Louisville, but to really figure out where the hot spots are, you've got to display your data correctly. And sometimes it takes not only a map to do that, but sometimes it takes somebody in a GIS position, holding up their hand and saying, stopping leadership and saying, "Look, folks, we're not showing this correctly. We're not communicating to ourselves and to the public where the real problems are." So I know for a fact that we were one of the first states to normalize our case data and display it on a public-facing dashboard. And the folks at Public Health, we brought this up to them, and they didn't talk about that in geospatial terms, but they understood what we were saying too. And so, they work with statistics and they know how to show problem areas. And so it was kind of interesting working with the folks in Public Health and understanding that they saw a need for that as well. Early in the series, this slideshow, one of the first things we did was work on a way to take this impact dashboard and the one that DPH has, Department for Public Health, and automate a process for keeping it up to date. And what we found is that the process was taking probably 2 hours every night to get the data, get it in the right format, get it pushed up to AGOL and wired up to the dashboard. Within a matter of probably 3 days, working with the folks at Public Health and Brian Bunch and my team, we were able to come up with a routine literally where Public Health drags and drops a file into a folder, and seconds later, these dashboards are updated. None of this, oh, I've got to upload this tonight and so's got to watch the clock and get this done. DPH drops the file, we get an email, the dashboards are updated. It is that slick, it is that easy, and it's still working today. And I know other states that are still spending 2 and 3 and 4 hours a day wiring up their dashboards every single day. So the hours saved, the resources saved in doing that were significant. Right. The DPH dashboard. So this is a very similar dashboard, but as you can see, this is the one that was on the cases tab in the Emergency Management Internal Hub. So this is what the leadership was seeing inside. This is the one that you saw on the screen that the governor was looking at. And public health is the one. This, they're the source of this information. A lot of people, want to know where this information is coming from. Where did you get it? This is coming from public health. This is coming from the labs. This is coming from the health departments. This information is being fed from the authoritative source. And I think that's important to point out. The temporal perspective. And if you've worked with us for very long, you'll know that we don't throw anything away. We've been archiving data for well over a decade now and sending it to Kentucky Department of Library and Archives. And at the beginning of this at this event, Will Holmes, Doug Eads, Brian Bunch, Kim, all of us, we knew, look, this data is going to come in, but you can't just overwrite the data for every day. You've got to keep this. You've got to have a time series. You've got to be able to look at this and how it's changed over time. So one of the things that we put together is some 7-day and 14-day averages on cases and deaths. And then you can access those services, and ArcGIS Online makes this fairly easy. You get you a nice little time slider here. And if you get your stuff set up right, you can kind of play through the entire event thus far and see how these patterns come and go across the state. And it's real interesting to watch specifically in late June to early July what kind of happens in Eastern Kentucky. Because up until that point, it almost looked like they were somewhat immune to this. And then boom, it really started to pop. The other thing, and Kim noted this very, very early on as the cases started to pop up, is it was all about our transportation networks. You start dropping your interstates and your US highways on top of these maps, and you can see what's going on. So you've got this spatial and temporal perspective. And just to reassure everybody, we're keeping, we're not throwing any data away. This is something we're going to be able to go back and look at over time and study. I don't know if KYTC or anybody from there is watching, or Will Holmes is on here right now, but if you've worked with Will in the past 2 or 3 years, you know that he's really high on doing things with real-time feeds. And they've got a tremendous amount of it, and this is truly big data coming into transportation from several different angles right now. And this was just another great example of real time. And what you're looking at here is a screenshot from one of those tabs in that asset and inventory dashboard. And so you can see what's coming in, what's going out of these different distribution facilities, and how that's changed from the beginning of the pandemic to the end of the pandemic. And they could make a change in a warehouse, and you would see those immediately reflected right here on these dashboards. So these dashboards were very, very prominent, are very prominent in the Emergency Operations Center. And once again, leadership is, has this at their fingertips and has the ability to use it. Now, there were struggles here. We're struggles getting, the warehouse staff to understand how important it was that they have to scan something and they do it in a timely manner. It was important to get their leadership to embrace something different other than the spreadsheet they'd used for decades. So, sometimes change is hard, and sometimes change under stress in a stressful situation is very difficult. But once folks started to see the benefit of this and the value, it was a little bit easier to convince folks to adopt it. So we're doing as much real time as we can. And once again, because we're not, overriding any data, we've got this temporal perspective. Back to the coronavirus hub site, the external one. Just briefly, one of the things I want to point out here is that if you, as a city, a county, a region, somebody at the state level, if you have a web map, or you have a dashboard, or you've got some sort of information that you can share publicly, and this is all for public-facing information. Look, we have a local resources section right here, and we've got the COVID site for Jefferson County on it, Lexington's, Northern Kentucky, Purchase, all of these different things that we could share that weren't sensitive, not sensitive information we've put out there. So if you have something you want to add, let us know. We got the word out early on this. We had some folks add some things, but it's probably been a month since we've added anything. So if you've got something that you're standing up or thinking about standing up, and you want to expose it, let us know. We'll help you find a way to get it out there. All right. Now, this is something, and I know at least 2 or 3 counties are taking advantage of this, but I don't know how many really are. And what I want to call your attention to, if you can see it, is across the bottom or in the browser window up here, you've got this URL, but then it ends in $county equals boom. Okay, so what you've got going on is we've set these up in such a way that you pass it these URL parameters, and it launches this page, brings up this impact planning report, shows you your county on the map, has the rate map here too, and then gives you some basic stats for that county. Now, this is mainly on the infographics page, and it's showing both this impact planning report. It's also got a state-based report, and then it's got Esri's COVID-19 county cases report. And so any county out there that wants to use this, embed this on their own websites or whatever, it's set up that way. And just like all the other dashboards, when public health drops that file every afternoon, these get updated. It's all automatic. And I know that I've had at least 2 counties reach out to me about how to do this. They were a little confused about it, and I think we've set them straight on how they can use it. But this is one of the dashboards. The other one that's probably even more interesting is the county-based statistics that has both the case map, the rate map. It's got the general map on it too, but it also has the new incidence rate, which you can see is being utilized quite a bit as it relates to how different counties are handling it, where they stand in terms of being critical or on track. So once again, in this case, we're looking at Anderson counties. So you're just doing this query string here, and you've got your time series here and your case average, your deaths, and things of that sort. So if you weren't aware of that, take a look at it. If you've got any questions, anybody on my team can help you. But it's out there, and it's a pretty cool way to just stick a link out on your webpage or embed it, and let folks see what's going on in for your geography. This is kind of a behind the scenes dashboard, and this is something that's used quite frequently by leadership. And what you're looking at here is a specific subset of acute care facilities. There's 96 being monitored. This is earlier in the day. They have to report by a certain time. And you can see by region, and Department of Public Health looks at things from these different regional breakdowns. You can see how many people they have as inpatient, how many of them are COVID, how many people are on ventilators, and things of that sort. So this is something that's really monitored heavily by our leadership. You can see you can filter by region, you can filter by county or by facility. And there's even reporting status by facility down here on this particular map. It kind of shows you who the players are, the good players and the bad players in terms of reporting. But most everybody's on track now, especially because of the new federal requirements. And very neat way to communicate to leadership what's going on. Automation, okay? I pointed out that one of the first things we did, and I say we in the sense of mainly Brian Bunch, is automated how public health data could be utilized to drive these maps. So we figured out very quickly how to do this and how to make all these dashboards update very quickly. And I don't know how many of you all have gone to the main KY COVID site out there. And for months there were, and I hope nobody's on here who made those maps, but for months there was some pretty hideous looking maps out there. And I had some folks at Public Health acknowledge, yes, there's some pretty hideous looking maps out there. And at about, I don't know, first or second week of July, we found out that somebody was spending about 2.5 hours a day, every day, 7 days a week since this began, making maps. Opening up ArcMap and creating maps, one by one, exporting files, and then putting those somewhere. Those were getting renamed, those were getting pushed around, put in reports, and put on the web page. Every day, 2.5 hours a day. So we were like, this is something we can do in seconds, folks. And literally what happens now is the data gets dropped in a file from public health. The dashboards get updated, and about 3 minutes later, a series of about 7 maps appears. They get these maps, they're generated, they're using the breakdowns they want, they're using the color schemes they want. We made them look nice. Actually the maps I did in Pro, and we're using Python to automate the process. Brian has got some scripts written that key up this process once the dashboards have been updated. And then Ian Horn's written a script that actually uploads these to Box where the folks can go get them. So once we got this done within a matter of days, the savings once again were tremendous. And it's really cool that these maps are being done just literally minutes every day rather than hours. All right, back to the economy. Once again, we didn't see this coming. And there's a lot of things going on with COVID. And of course, we know this has impacted our economy. There's nobody that's not aware of that. But we didn't realize who all was paying attention, I'll put it that way. And so all of a sudden we're getting contacted by various folks that want to talk to us about what's this economy dashboard you got? You know, how are you using it? Is it used internally? Is it used externally? All of these sorts of questions. And so Esri reached out to us, and there's a blog post in their Esri newsroom blog. And as Jenny stated here, you know, people are hungry for information right now, and they're looking for all sorts of things. And Jenny's right. You know, folks are going out, they are trying to find information out about not only the economy, but everything else going on as it relates to COVID. And this is really a niche that a lot of folks have latched onto. And as Kevin noted, you know, sure, a plant shuts down, a school shuts down, a restaurant shuts down, but there's a ripple effect to that. You know, where do these people go eat lunch? Where did they get gas? All those other things are affected by those closings. And Kevin is the one who worked with Jenny to put together that dashboard. And so hats off to them and their efforts for pulling that together. We've got some good recognition. Prior to that, the folks at Harvard Kennedy School reached out to us, and also wanted to talk about this dashboard. And one of the things they were interested in too was a lot of the collaboration that was going on and a lot of the data sharing. And I thought it was very interesting that not only did they call attention to the economic aspect of it, but also realize the value in the collaboration and the data sharing. And, you know, it became very apparent to them we have this culture of open data. And it was very clear that this has really paid off for us, and that we had these hundreds of layers coming in from all these different agencies, and that this really did truly position us well to support the COVID-related response activities. A couple of examples, and I've got so many more than what are on the slide here, but we were looking at accessible locations for COVID testing sites early on. Kentucky's, you know, all the libraries were shut down. Well, they've all got nice parking lots, and so one of the ideas was, hey, we could put them in the parking lots. We had hospitals. We had that information ready. We were able to finish cleaning up the fire stations. The National Guard called one day and wanted a map of state parks and lodges. We're like, that seems kind of odd. And then they explained what they wanted it for. They wanted it for first responder housing. And furthermore, they wanted not only to know where the lodging opportunities were, but they wanted to drill down a little bit more. And they were really interested in where the cottages were, because they knew that individual people could stay in those cottages and it wouldn't be, from a socially distanced perspective, it wouldn't be as close as if they put them all in the hotel rooms. So, you know, working with parks and those folks, literally within 24 hours, we had the cottages already mapped. We just didn't know the number of occupants per cottage that were allowed. So we got all of that in there. So, you know, bottom line, this is why we share data. You know, having access to all this data in these platforms, as Jack pointed out, has been critical for enabling rapid response and enabling the collaboration. The fact that we've got the data and we've got the platform is really what has allowed us to do this. I had somebody ask me, is really anybody using this stuff? And this is just a little snapshot here of our stats that Ian runs every month. And you can see that in March, we were actually a little down from the previous months, but in April, 43 million requests, May 74. Now we're starting to plateau a little bit, but yeah, folks are using this stuff. And a little lesson learned is that early on we thought, well, we'll stand this up on our portal instance. In our portal instance, it isn't a small server by any stretch of the imagination, but when you start throwing millions of server requests at even a decent sized server, you can have some issues. So we immediately saw we were having some issues, pulled it off our portal and put it up on our really, really big box. We haven't had any performance issues since then, but sometimes you may want to think close or think carefully about where you stage your applications. And we're on track to have the biggest year yet already. We've 388 million requests just through the end of August. Geospatial Preparedness GIS Subcommittee. This is something that is spun up as a result of this response effort. It was formally created at the last virtual GIAC meeting. The mission statement here, I'm not going to read it to you, but you know, these are the different parts of the mission statement. And as you can see, a lot of it is about sharing data, communicating, and collaborating. And I think the result of this body coming together, obviously it's important for the COVID effort, but for all emergency management efforts going forward, this is going to be really, really key. Member tasks. So we don't have the full membership populated yet, but want to advocate and educate concerning the common vision. identify priorities, and we're trying to foster the support for improved data methods. Let's get away from past spreadsheets around and things of that sort. Let's look at who's requesting different things and make sure that it's appropriate. Let's establish a quality process of inquiry, logical, rigorous, and ongoing. And we need people around the table with the authority to approve these different procedures and operations that are being put in place, to identify priorities on behalf of their cabinets, and to identify different trained managers and data analysts, not only that need access to different things, but also can play a role in making sure that we're using the right data and using the appropriate statistical methods. I think this is very key going forward, and this is co-chaired by Doug Eads from Emergency Management, and Mike Schutze from the CHFS Office of Health Data Analytics. And Karen Chrisman came up with our mission statement and our member task. She works with the Commonwealth Office of Technology, and we're trying to really empower these co-chairs to move this forward to the next level. Okay, and one last one there I missed. Challenges. And I alluded to this earlier. We still need to continue to improve and streamline communications. There's still instances, and especially when people are stressed out, where communications could be improved upon. We've got to raise more internal awareness about GIS and thinking spatially. And sometimes that's incumbent upon us as GIS professionals to do that. We need a greater leadership utilization of geospatial technologies for decision support. I think this pandemic is pushing us that way. I think there's no doubt about it, but there's still areas for improvement. Once again, data sharing is great here in Kentucky, but there is still room for improvement. We still have some agencies, we still have entities spread out there that for one reason or another cannot or will not share their data. And we need to continue to work with those folks. Sometimes maybe they can't, maybe there's a good reason. Sometimes maybe they don't know how, but there's room for improvement there. And then just consideration of the spatial perspective. There are so many times, especially in IT, especially at leadership levels, where that's the last thing that's asked for. Leadership asks for information, and they get data. They get a spreadsheet. They get a piece of paper. That's not information, that's data. You have to look at that spreadsheet. You have to look at that piece of paper. You have to draw conclusions from it. You have to say, okay, hey, I see Clay County here has a high number. Now, where is Clay County? You know, let's not hand people spreadsheets. Let's hand people maps. Put the spreadsheet below the map or whatever. But once again, I think it's incumbent upon us as GIS professionals to raise our hands sometimes and say, hey, stop, we need to do this a different way. Sometimes we're not even at the table, and that's a problem. But it's definitely a challenge that's ahead of us, and a lot of these things aren't new. We've known these for many years. All right, acknowledgements. It looks like we're getting to the point I got to wrap up anyway. So the KYEM GIS IT team, Emergency Management, Doug Eads, John Crowley, all of those folks over there, Transportation Cabinet, Will Holmes, Mitchell, Emily, and all the other people that work with him, Department for Public Health. The specific person we've interfaced with has been Ben Scott. Ben had a little bit of GIS skills, and because of that, was able to communicate internally that, hey, these are the ways we need to do it. These are the tools we need to use. And thanks to him for realizing that. Brian Bunch. Anybody that knows Brian knows that he and I are good friends. And I'll tell you, it's Brian that has really helped us make things efficient, automate things to a degree that it works so smoothly. And try to say thanks to Brian as often as I can, but I'm sure I don't do it often enough. Kim, if you don't know my wife, Kim, you probably should, but I can tell you one thing. The reason that our wealth of data is accessible, the reason it makes sense in terms of how you can get to it, the reason that we know what we have and know how to use it that's because of her. That's not because of me or anybody else out there. Sure, everybody's contributed, but I guess in a simple term, she's our librarian. She knows what we have, where it came from, what its vintage is, how to get to it, and what its use constraints are in many cases. And the wealth of knowledge that she has about our data assets is incredible. And she's the reason we were really able to hit the ground running in this event, is because I could turn to her or Brian or Will or Doug or anybody else and say, do we have this? Where is it? And is it appropriate to use it this way? Many, many hats off to her. All right. The rest of my team, Horn and Kevin Hogue as well. I'm sure they're ready for all this to be over, because I'm pushing them in all sorts of different directions to do things and learn things. And they've been extremely professional and on point throughout this whole thing. And just like everybody else, they're having to deal with the stress of the pandemic. In my leadership, my executive director, Carrie Welch, and the new CIO, Ruth Day, they've been very supportive throughout all of this. I think we have a unique CIO right now. And the reason I say that is because she gets this difference between what is data and what is information. And she understands what we have accomplished in terms of sharing. And their support has been key to everybody's success. And once again, hats off to everybody who's sitting here listening to this today. You know, if you've done any sort of mapping, contributed any sort of data, networked with people, attended conferences, promoted GIS in your own community, then you're a part of this success as well. And I think it was really good to hear what Jack said this morning. He was really thanking everybody for what you do on a daily basis, and don't take what our counterparts in this Commonwealth are doing. It's pretty powerful. There will be a link to this. You'll be able to get this handout, or we'll send it out. And we'll leave it there for questions. Let me see. I think timing's pretty good.
Yeah, and, you're doing great on time there, Kent. You got 7 minutes left. Okay. There was a question from Lauren Weaver about the link. It looks like Ian Horn has added that link to the chat window if folks want to take a look at that.
Very good.
Otherwise, if anyone has any questions, you can just unmute yourself and ask.
Hi, I have a question. Can you guys hear me okay?
Yes.
Okay, so this is Lauren Weaver again. I think you guys have done great work here, and it's been encouraging for me to see the work that you guys have been doing as the pandemic continues to take grip. So thank you for being at the forefront of the technology and moving this forward. My question is whether that data will be made available, perhaps upon request, to folks in the future. I don't know how sensitive that is, but it would be amazing data to study from an epidemiological and a GIS perspective. I'm certainly interested in playing with it.
Yeah, absolutely. The all of the case data, the averages, the incidence rates, all of that. Those are public facing services, and those are public facing web maps. And so, that stuff's out there. If there's a particular dashboard that you've gone to look at and you're like, hey, you want to know more about what's feeding that, reach out to somebody on my team, and we'll send you a link to that web map, because it's just a bunch of web maps out on AGOL that's pulling from those services. So now there is some internal information that isn't being shared, but as it relates to all the case data and anything you see on a public facing dashboard, yeah, it's out there and it's not going anywhere. So just let us know what you need access to, and if it's publicly available, we'll make sure you get a link. Looks like Toby, Kentucky American. Yeah, the hospital long-term care facilities, I believe, are both out for download from the KY Geo portal already. I know the hospitals are out there, and I think long-term care facilities are. If not, there's definitely a service that's already out there that you can tap into. But if you all reach out to Kevin Hogue, he can hook you up with those data sets.
If nobody else has any questions, I can come up with plenty of questions. I'm curious what trends you guys might be expecting or even observing, like trends that maybe we're not discussing in the mainstream media, or predictions that are totally speculative, but you think might happen in the coming months and perhaps the coming years as we continue on this path.
Yeah, I'm certainly not an epidemiologist, and I'm not an expert. The trends we noticed early in the pandemic, and some of the things that we predicted would happen have happened. One of the first trends, as I pointed out, is we saw it spread along the transportation networks. It was very clear that was happening, and I think Kim pointed that out just almost immediately. The other thing that we were just waiting for, and I kind of alluded to this in the time series map, and we were just waiting for it to happen, was for it to explode in Eastern Kentucky, and that's happening. The thing that we didn't readily expect, but it happened, was what happened in the western part of the state. We didn't expect it to explode out there the way it did. But I don't want to speculate on what's going to happen in the future. I think unfortunately, the cases are going to continue to rise. Let's just hope this incidence rate continues to go down. That's what we all need to hope for. I certainly don't have a silver ball.
Hey, Kent.
Yeah.
This is Will. If I can jump in just for a second and expand a little bit. One thing, anybody that, particularly if you're working on more of a border county, we know Kentucky is not an island, and that was something that Kent and Kim were very aware of early, that we knew that, as Tennessee made decisions about what to stay open and what to close, et cetera, that would have a ripple effect in southern Kentucky. The same kind of thing along the Ohio River for adjacent states. So that tied, and again, you can absolutely see it in the data, that tied to the transportation network. You could see the counties bloom where you had interstates and parkways leading in from adjacent states that were not trying to manage as well as Kentucky was.
Correct. We are not an island. Yeah. Yeah. All right. Yeah. It looks like Kevin posted the link to the GeoPortal stuff out there. Cool.
We got 1 minute left.
Yeah, thanks, Ben. I can tell you, been on a lot of national based calls, and we have really succeeded in some areas, and we're still behind in some areas. But I can tell you one thing, we're closer to the top of the pack than the bottom of the pack nationally. And once again, that's just because of this community, and that's because of our willingness to share and our willingness to collaborate. So I probably said it 100 times during the presentation, but everybody needs to pat themselves on the back. We've got something pretty special here in Kentucky. We just need to continue to build upon it.
Yeah, and that goes back into the 80s even, with Logic and Kurt, and then Ken Bates, you know, at Natural Resources. There's just been a long-standing culture of collaboration, and I'm very grateful that we get to be part of that. So props to you, Kent, and your team. This was a really good presentation, and I think I would encourage the rest of the community to kind of build on this wherever you are, to expand your network and collaboration.
Absolutely will. Thank you.
Well, we're out of time, but I certainly don't want to close the room if anybody has any more questions.
Yeah, I appreciate everybody's time. If you do have any other questions, reach out to me or anybody on the team. We can try to get those answered. And if we don't know the answer, we'll reach out to the folks that do. There was a lot of cooks in the kitchen, and amazingly, we did well and didn't step on any toes.
I have a quick question, Kent. I mean, are you planning to take this show on the road? Or are you going to present anywhere else, Uriza or Esri, further down the road?
I don't know. I mean, I guess we could. It really wasn't something that had come to mind, but we did a small piece of it, mainly just the story map piece of it at the GIAC meeting. But I knew we'd need about an hour, and that's one of the reasons I asked for an hour slot to get through it all. There's too many people to thank. There's too many examples to show. And you know, you almost need an hour in this to really drive the point home. So, yeah, if the opportunity presents itself, we certainly could give this presentation elsewhere.
Okay. Well, with that, if there's no other questions, Kent, this was great. Thanks for doing that.
All righty. Thanks to all. Appreciate it.
Thanks. Bye.
Have a good day.
All right. See y'all.